As the Canadian healthcare system grapples with unprecedented challenges caused by the COVID-19 pandemic, a heated debate between provincial premiers and the federal government revolving around funding allocation rages on. And while the need for additional government funds is evident, doctors and healthcare professionals are arguing that a fundamental overhaul in healthcare delivery is just as important. Strained hospitals, overwhelmed pediatric facilities, and a backlog of surgeries has prompted a call for changes in our healthcare system. Joining us now to dive into these potential structural changes is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you very much for coming back on Forum Daily.
Great to be here.
We've seen reports of doctors saying that the pandemic broke the healthcare system, but that it was already operating at full capacity before the pandemic. In your view as a doctor, why is the system so fragile?
Well, prior to the pandemic, our healthcare system was already grappling with a lot of challenges. Big challenges being, of course, a shortage to healthcare professionals, including doctors and nurses. So when the pandemic occurred, of course, it took us to near and full capacity and even beyond. If you look at the Children's Hospital of Eastern Ontario or the Alberta Children's Hospital, which went beyond capacity here as well. And not to mention, with the pandemic came these other strains as well. RSV has become quite strong recently, not to mention influenza. So, and these have all just served to highlight our vulnerability as a healthcare system.
And we know that some of these hospital systems or medical systems are, as you mentioned, back beyond capacity now. It is that time of year. And so naturally, obviously, there is an influx in the need for medical care. But how is this impacting the doctors and nurses who provide care? Are we seeing burnout?
Yes, well, our Canadian Medical Association does conduct some surveys, and what they found quite recently is that in 2021, about 53% of doctors reported experiencing burnout, and this is compared to just 30% in 2017. So we saw a huge increase there. We also saw that, all of these hospitals as well, they put a lot of additional strain on physicians, especially if they have to work beyond capacity. So we do see that burnout being translated there in physicians as well as nurses as well.
And what are some of the main dangers of that burnout?
I think burnout provides a lot of dangers to our healthcare system here. We're talking about a situation where if you're working over capacity, you're going to see increased medical errors, you're going to see compromised patient safety, and there's going to be a lot of long-term health consequences for healthcare professionals. And the biggest burnout is the fact that if the system is fragile to begin with, having people with burnout exiting the system is going to be something that's very concerning.
And the CMA has said that family doctors on average work about 52 hours a week, but only 36 of those hours are actually spent providing care. What are those other hours spent doing, and how do we restructure the system so that doctors are spending more time caring for patients and less time with that other work or other workload that's taking up those hours?
Yeah, that's a great question. So there is a gigantic administrative burden on physicians, and this burden doesn't seem to be going away anytime soon. It's likely going to worsen. In fact, every government agency, every hospital, every insurance company, every travel agency now requires a 2 to 5 page document to be filled out before they can even hear what the doctor has to say. So we're going to have to do a lot of major restructuring there and major changes in advocacy. So I think, helping with administrative staff support, funding that, and providing funding for EMRs that are linked in a broader system will all be very helpful towards a more collaborative approach.
And I want to talk about ER rooms because that is something that's come up as of late. We know that in Quebec, the province urged people to avoid the emergency room. In an ideal world, the ER is for exactly that, emergencies. But how do we shift the system so that it can be more reliant on non-hospital services?
I think the key with that is to really focus on accessible community-based healthcare services. allowing family physicians and primary care providers to really function very well outside of the hospital. And we are very reliant on all the specialist services in the hospital to really function right now. There's also a thought of national licensure. So you have family doctors being able to work wherever they like, so they can provide assistance in those facilities. And then finally, also looking at more efficient data sharing. So that would be helpful, and patients could really be cared for outside the hospital in their own homes.
Dr. Raut, thank you very much for your time.
Thanks so much for having me.